International Women's Day is celebrated across the globe on the 8th of March as an annual milestone that recognizes women's achievements and a call to action to stand for women's rights and gender equality. The African Union Mission in Somalia, AMISOM, as a mission principle, is committed to the rights of all people regardless of gender, granting all the same rights, privileges, and access to opportunities in shaping a more equal future as the world recovers from the Covid-19 pandemic. This year's theme is Women in Leadership, Achieving an Equal Future in a COVID-19 World. AMISOM uniformed women peacekeepers and personnel have demonstrated their skills, knowledge, and networks in effectively leading in COVID-19 response and recovery efforts in Somalia, making a positive impact both in supporting the role of women in peace building and protecting women's rights, despite the social dimensions brought on by the global public health threat, coronavirus, or COVID-19.
In spite of COVID-19, we had to step up and put forward our best foot to be able to deliver on our mandate. So everyone had to put their hand on the deck to make sure they went the extra mile to do what was needed and made our deliverables achievable. For the first time, we also had our mission implementation plan meeting virtually. So nothing was restricting us. What we thought was impossible became an easy walkover.
The AMISOM Public Information Office works to provide visibility for all three components of the mission, that is military, police, and civilian sectors. Beyond this, the mission works with the Somali Ministry of Information to help in capacity building, supporting government programs, and the Somali National Army and Police. The AMISOM Public Information Office stepped up its response in stemming the tide of the COVID-19 pandemic and its broader socio-economic impacts.
COVID is new. We've all been in crisis situations, but nothing in the magnitude of COVID. And nobody could have predicted and nobody could have planned for it. So a lot of the mission work that was done in terms of the COVID task force in that crisis was one of the things I'm really proud of. Immediately, a lot of policies had to change. We had to change a lot of things, work along as we go, in terms of being able to deliver content and producing materials that goes into every forward operating base, every sector, every region, being able to cater for soldiers, military, police, civilian. I mean, there's a lot of work that went into that.
AMISOM women peacekeepers stood at the front lines of the COVID-19 crisis as health workers, innovators, community organizers showed some of the most exemplary and effective leadership in combating the pandemic.
When the flight ban started happening, I was in Mogadishu and international borders were closed. So I was here. But I also worked with the COVID task force, which had been set up by the mission. I particularly worked with the medical cluster, and our task was to get as much as we can public health and safety information out there. So all the safety protocols and everything that the medical cluster would work on, our job was to get it out there into the regions, into the sector, into the forward operating bases, into local radio and television stations.
With over 20,000 uniformed troops deployed in 6 regional sectors across Somalia, AMISOM immediately set up medical response units within its Level 2 hospitals to halt the potential spread of the virus to its forces from regional troop-contributing countries and police-contributing countries. Warrant Officer Proskovia Abalo serves as a clinical officer in the COVID-19 isolation unit in AMISOM's Level 2 hospital in Mogadishu.
We have managed to create awareness among the troops about the danger of COVID-19 and how we can prevent. And all this were possible because of the good leadership among the AMISOM and the UPDF.
In the past year, the military component of the mission has supported a gradual takeover of Somali security forces from AMISOM, as well as in assisting the Somali security forces provide security for the political process at all levels in stabilization, reconciliation, and peace building in Somalia. A national lockdown and other COVID-19 imposed restrictions often prove challenging for frontline peacekeepers in reinforcing mandate-led initiatives in human rights and gender and the protection of civilians in local communities.
Because of COVID, we cannot go straight in the community. So we resulted into using televisions, communicating through the televisions, through the radios, and sending SMS.
And I must say that it is challenging sometimes to be in such environments in the mission area. However, it is service to humanity, and it is our call to enhance the capability of the Somali security forces for sustainable peace in Somalia. So that gives us the satisfaction to be here.
As the race to end the pandemic continued on a global scale, AMISOM peacekeepers recognized early on they could not work in silos. And despite the challenges encountered during the implementation of most projects in Somalia during this time, significant achievement in regard to women empowerment enabled by AMISOM in partnership with the federal government of Somalia were realized in targeted communities.
I was able to reach far and wide, sometimes not in person, but through the SPF and through our gender officers that we have in the police stations, the sectors, and also in the districts. We give them those trainings, and it has impacted a lot on the people, such as even the IDP camp people, because when we visit them, they are happy to see us.
The COVID-19 pandemic presents a global crisis that is exacerbating gender injustices and increasing violence against women. In Somalia, according to the 2020 UNDP Gender-Based Violence and Female Genital Mutilation Rapid Assessment Report Trends, 38% of community members indicated an increase in GBV incidences compared to the period before the COVID-19 pandemic.
We could not reach out to the survivors as a result of those restrictive measures put in place, like total lockdowns, shutdowns, and all that. And also it was difficult to monitor the violations to see if they are happening. Of course, we were fortunate to have some community structures still operating.
AMISOM, jointly with the Somali government, has an essential role to play during sustained violence against women prevention work through the Gender Protection and Human Rights Unit. Kabila Mbuton, who serves as the AMISOM Human Rights Officer, Child Protection Focal Person, and a member of the civilian sector team in Baidoa, Southwest State, explains.
We had to then think of new ways to be able to do our work, and it required a lot of consideration of all the technical implications and all the possibilities of also getting to connect with the communities that are the beneficiaries of our work, and also to connect with colleagues who were stuck in different parts of the world and had to be working from home in one way or the other.
There has been considerable progress over the last few years in more comprehensively advancing the women peace and security agenda as part of the AMISOM peacekeeping mandates.
After careful thought and consultations amongst ourselves, we then arrived at one of the solutions that has worked for us really well so far, and that has been to hold virtual consultations. Through these virtual trainings, virtual engagement, we can say we've been able to reach even more people than we would have reached in a single session or we would have reached in our in-person meetings.
Women continue to play an influential role in shaping the expectations of peacekeeping missions when it comes to integrating change across their functions and areas of work. the COVID-19 response offers a transformative opportunity to build back better into a more peaceful, sustainable, and equitable world.